practice for 9 years now, and I'm one of the only 2 Black dermatologists in all of Monroe County, and so because of that, the bulk of patients that are African American that have lupus or autoimmune conditions affecting the hair or the scalp, they tend to end up in my office. So I've been really lucky to, accumulate a lot of those nice patients over the past 9 years that struggle with hair loss and autoimmune problems affecting the hair or the scalp. When I see a patient with lupus that is attacking the hair or the scalp, one of the first things that we do is provide a topical steroid. They're usually fairly potent topical steroids, and they come in a variety of vehicles. Sometimes they're liquids, sometimes they're oils, sometimes they're ointments. Many times what we will do is intralesional steroids, which means that we actually take a small needle and inject a steroid medicine directly into the scalp. That's a very good treatment for getting lupus on the scalp calmed down to preserve the hair. Many times patients end up having to take a medicine called an anti-malarial, which are these group of drugs that were initially used to treat malaria, but they actually have pretty profound anti-inflammatory effects. So things like hydroxychloroquine is a medication that's commonly used. Now sometimes patients need more intense medications to control their lupus, things like prednisone or mycophenolate mofetil. Those are some of the other medications that we use for more severe lupus. When you see a dermatologist, you want to make sure, first of all, that your hair is in a style where the entire scalp can be viewed. So it's really not helpful to see a dermatologist if you have your hair even in a protective style, like cornrows or braids or something like that, because it's difficult for us to get a sense of the whole architecture of the scalp. Ideally, the hair should be, loose and out for us to view. One of the things that you want to make sure to talk to your dermatologist about is, what kind of lupus do I have? Do I have just skin lupus that's just affecting the scalp, or do I have systemic lupus, which could be associated with internal organ issues? So you want to make sure to ask the question, do I have cutaneous lupus or just skin lupus, or do I have systemic lupus? That's one of the main questions. You always want to ask about, what are the treatment options for me? What are all of the treatment options that are available? Even if a dermatologist recommends one course of action, it's a reasonable thing to ask, is there any other thing that we could try? Is there anything else on the table? Always ask about the side effects of medications and whether or not a medicine that you're being given has interactions with your other medicines. Anyone that's experiencing severe itching on the scalp should really consult a board-certified dermatologist to look into what's going on with the scalp. Normal, mild itching here and there is okay, but if someone is experiencing severe itching on the scalp, that's something that really should be investigated by a dermatologist. Certainly anyone that notices a discoloration of the scalp, that hyper or hypopigmentation, should be seen by a board-certified dermatologist. Anyone that has any blisters on the scalp should come in right away. And then that generalized thinning that we talked about, anyone that's experiencing overall really kind of dramatic thinning or shedding of the hair, that should trigger them to come see a dermatologist. There are several different ways in which lupus can affect the hair and the scalp of patients with black skin. One of the more common presentations of lupus on the scalp that I see in patients with black skin is something called discoid lupus, where patients basically get these scar-like plaques on their scalp that can lead to areas of hyper or hypopigmentation, meaning you get a round area where there's no hair growing and the skin on the scalp is either much, much lighter or much, much darker than its normal color. Sometimes you'll actually see hyper and hypopigmentation combined. So you'll see those scarred areas with areas that are much lighter and areas that are much darker than their normal color. Sometimes patients get a condition called bullous lupus where they actually get small blisters on the scalp. I've seen that several times in African American patients. And then other times patients get something called non-scarring alopecia, which is more of a diffuse, all over thinning of the hair, not that it comes out in chunks or forms scars that are round, but the hair just kind of generally looks thinner than it should be, almost like it takes on the characteristics of a baby scalp.